Well, welcome everyone to actually our first virtual town hall of 2021, but another town hall in the series for ARMA. Just a little Zoom housekeeping to quickly cover. This is a professional environment. We ask everyone to remain respectful towards all participants. The webinar is being recorded, will be published on our YouTube channel as well as dedicated websites at a later date. You can see and hear the panelists, but we cannot see or hear you. The webinar is best accessed through a computer utilizing the various different functions as well that come with the Zoom application, such as the Q&A. That is how we will be taking questions tonight and answering them in that order. So be sure to find the Q&A button and submit any questions you may have throughout the evening. And then the best viewing option for you is to fit it to your window. Tonight's moderators include Juliana Stanley. She is ARMA's Director of Membership and Practice Support, as well as myself, Damian Johnson, ARMA's Director of Communications. Our guest panelists tonight include Dr. Teresa Birch. She's Chief Medical Officer at the Guidance Center. Dr. Mark Carroll. He is Chief Medical Officer for Health Choice Arizona. Jay Sandys, Vice President of Organizational Development at CCA. And then Manendra Bugra, she is the Manager Learning and Development over at CCA. So at this time, I'm going to stop sharing my screen and pass it on to Manendra.
Thank you so much. All right, so I'm going to go ahead and share my screen as well. I want to thank all of you for joining us today and participating in this webinar. And as was shared, we would love to hear your questions as we go through this presentation. We'll address those questions towards the end of the presentation. Just kick us off today is really helping you understand and give you an idea of how we came about creating the peer assistance program, the virtual doctor's lounge that we're going to be talking about with our panelists in just a few minutes. But we wanted to share with you what we understand and why these types of programs are so important in terms of understanding some of the distress that has been documented for physicians. Really taking a look at the impact of burnout and how we experience burnout, and particularly for physicians, what burnout can look like. And what are some of the barriers that we're hoping to overcome by creating this virtual doctor's lounge, creating a peer assistance program, but really understanding and making sure that we acknowledge those barriers that come with seeking help. So in terms of what we know and the distress that physicians experience and some of the statistics that have been gathered is that we know approximately 44%, which is a significantly high number of physicians experience symptoms of burnout and not always immediately recognizable. We also recognize and acknowledge that medical residents, in particular, 28% of them could be suffering from mental health concerns, including, and more specifically, looking at depression as one of the diagnosable disorders that medical residents experience. But this all leads us to kind of look at the impact of the symptoms that people are experiencing and when they're not seeking out or not able to get help for whatever the reasons are. And over 400 physicians commit suicide each year. And this statistics that we're looking at, these were statistics that were researched before our current state of dealing with COVID and the stress that physicians are experiencing. And if it doesn't necessarily result in a variety of the symptoms that we just spoke about, we know that because of the avoidance that people have, particularly physicians have, for seeking out mental health support, it can also result in other ways of coping with those symptoms, including substance use. So 10 to 12% of physicians may have a substance use disorder. And the reality of all of this, and again, looking at some of this research is before the current state of affairs and really thinking about COVID, these statistics were already high. Right. And so related to that, what is burnout? How do we experience burnout? So a simple definition of burnout is it is a work-related condition, and it's a condition that is characterized by feeling emotionally exhausted. by disconnecting and depersonalizing or feeling a detachment from yourself, from your identity. And it also results in us feeling a reduced sense of personal accomplishment. And in essence, as a result of that, not feeling connected can also feel in some ways like we're not as valued, or physicians aren't as valued. So some of the reasons why burnout occurs, and of course this is going to be unique and different to every single person, but what we have found in the research that is available is that physician fatigue is going to be at the top of that list. And I think one of the things that we're hearing a lot about over the course of the last little while, in particular, is how exhausted people are, how physicians in particular are taking the brunt of that exhaustion, having a high workload, complex populations, shortened visit times with patients, just the amount of clerical administrative work that is accompanying a lot of the work that people are doing. And through all of that, what is also important to acknowledge and recognize is trauma that people experience. If there's concern about making a mistake, if there's concern about poor patient care. And when we think about and look at and understand COVID as an additional challenge to all of this, we know that physicians are feeling incredibly isolated, feeling like they have to tackle all of this on their own, and having to navigate the lack of PPEs and supplies and all those long extended shifts, being away from their usual colleagues if they're supporting other units, and supporting other colleagues in terms of around COVID treatment. But it also means that you may be feeling very isolated or from your own families, because the fear that you may have of getting the virus or potentially bringing it home with you. We know that we have heard from doctors who particularly have been avoiding their family members. There was one particular story that I heard of a family where, as a physician coming home and not having hugged their own family for a very, I think, months at a time, just out of that fear, even though they were taking all the precautions. Really being placed into a situation, whether it's your role or having to cope with treating the virus with very limited training, very limited understanding, and the death that is occurring all around us. And not only just the death, but the quickness of the decompensation of those patients, but also not always knowing how someone is going to respond to the virus, who's going to get sick and who's not going to get sick, who's going to get better and who's not going to get better. And so all of these things, if we add to the fact that we're aware that burnout was already a risk that physicians faced, that risk is even higher today. We know as a result of burnout, the impact of those of that could result in substance use disorders, substance abuse, like we talked about. It can also result in depression and suicide ideation. There's concerns about car accidents from that fatigue or just being distracted. It can result in near misses. But ultimately, what it comes down to is burnout results in a significant lack of self-care, because you're already tired, and to think about having to do something else can be even more exhausting. So in terms of what are some of the barriers as we understand it, and please again share with us in the Q&A if there's questions that you have around this, or if there's questions that you would like us to answer as it relates to the virtual doctor's lounge. We know that confidentiality is a concern, and we will definitely tackle that in our conversation with our panelists today. We know that there's concern about how this might impact on medical licensures. And these can be significant barriers to people reaching out and getting support and getting help. In fact, in 2014, as you can see from the slide in front of you, an estimated 40% of physicians were so reluctant to seek medical care, specifically citing licensure concerns as being the reason why they were not reaching out for support. And so, related to that, and knowing that many medical licensing boards will ask about mental health concerns and whether there's current impairment, and that can further deter someone from reaching out for support out of concern or fear of not being able to maintain your license. We also know that institutional cultures, while that is potentially changing now, it has been one of the barriers because of the stigmatization of mental health concerns, and even the stigmatization around getting help. So even though we know it never before have people talked about mental health as much as they are now, we do know that this is a barrier and can impact people from reaching out and getting support. And physicians in general have a tendency to internalize. In other words, they take it inwards. They focus on supporting others and not oftentimes thinking about how they need to support themselves. And as a result of that, it's a very hard for them to reach out and seek out support. So in terms of solutions and what we're hoping that people will really reach out and get some support and get some help, obviously we want to encourage organizations to provide support like training and flexible work arrangements when that is possible and when that is available. We would encourage state medical licensing boards to think about the requirements. And when they're asking about current impairment and not a history of mental health concerns, we want to create healthy professional environments through education and stigma reduction. But ultimately, and what we want to focus in our presentation today and with our panelists is this idea of community support and how you as physicians are able to be there for each other, to give each other a listening ear, and really thinking about that in the context of a peer assistance program. So we encourage you to take advantage of the virtual doctor's lounge. And I want to turn the conversation over at this point to talking with our panelists about their experience and some of the strategies that they can share with us. So I'm going to go ahead and stop sharing my screen here and ask our panelists to join us. And we have a series of questions. And again, we will be responding to any questions that you have as a part of this presentation towards the end of the presentation today. So to kick us off, for all of our panelists, one of the questions I have for you is that over the last several months, medical professionals, particularly doctors, have been experiencing so much stress with very little relief in sight. Can you share with us and our audience how you have been dealing with that stress yourselves and how you may have been impacted by that stress? So why don't we go ahead and start with Dr. Birch, if you don't mind.
It looks like Dr. Carroll is in the dark.
Dr. Carroll was on for a second and then in the dark.
Are you in your car?
I'm in my car, but that's a story after yours, Teresa. Go ahead.
You know, the car has become the Zoom cone of silence. You know, for all of you guys that are, you know, remember watching Get Smart. I love that, the cone of silence. Yeah, so what I would have to say in terms of my own self as a chief medical officer, the amount of information that I had to assimilate early on in the COVID crisis was very overwhelming. I felt like I was making decisions about things that I didn't know a lot about. And I'm used to feeling really well oiled in terms of understanding what the rules and regulations are, the accreditation standards, what our capacity was, and COVID really threw that for a loop because there was information that was not standardized yet. You know, a lot of the information I was getting from other friends, colleagues who were practicing in areas that maybe had more COVID. My facility is a behavioral health center, and we have a psychiatric hospital, psychiatric emergency room. And really, there was nothing about how do you manage people who have psychiatric disorders, especially people who are getting admitted on an involuntary basis into our psychiatric hospital. And the experience that Wuhan had, and even some of our initial psychiatric facilities who had outbreaks, was that they didn't have a lot of things that they could do, and many people died. And one of the big ways they handled it was they closed their facility and everybody had to stay inside. And that really wasn't an option for us. And so trying to make decisions about reducing our capacity, because in a psychiatric facility, people share rooms. And so in order to be able to isolate appropriately, we had to decrease our census in half, which has put a tremendous financial strain on our organization because now it's been going on for almost a year. And, we're still providing the same level of care, and we still have to have the same number of nurses and techs. We also didn't have PPE. And so we were trying to scramble to get ourselves on any list of prioritization. And psychiatric hospitals were not considered in many of the first rounds of distribution for PPE. Fortunately, we live in a county that is very well integrated in terms of collaboration and resources. And so we were able to participate in those kinds of conversations, and we're able to figure out a way for us to get PPE and testing and work towards developing best practices. And I think that that has been really a tremendous value for us as an organization, is being able to meet. There was a period of time where we were meeting daily with our community partners, and then it went to weekly. And now it's decreased down to monthly. But that social support, I think, was very key in terms of my own stress level, for at least understanding that other people didn't know either. So, maybe I didn't know, but it wasn't like there was an answer out there, although I kept looking. And so, just resolving like, okay, well, help is not coming. We just need to do this on our own and figure it out. So that was going on from a professional level. On a personal level, I work at 3 different places. I'm actually the vice president of the NARBA Institute, which owns the Guidance Center as an affiliate. And so I'm deployed over there as a chief medical officer. I'm the vice president of medical affairs at the NARBA Institute. So I have that whole email system and all those HR processes. Then I work at another facility that has its own email system, its own electronic medical record. And then up until a month ago, I did a clinic at one of the federally qualified healthcare centers, and they had their own email system, their own payroll system, their own EMR. And both of those, my facility and the other one, had an EMR conversion right during the pandemic. And first, my facility did it 2 weeks before the pandemic was declared. And then the other facility that I worked at did it in July. And I'll have to say that second implementation for me pushed me over the edge. I could not deal with so many different electronic systems, and then having to, every single Zoom meeting that I had and everything converted to Zoom, I was having to coach people on how to use Zoom. You spend the first 7 minutes like, the button is down in the left. You see that video? See the thing that looks like a video? Point to that, click on that. And one of the ways I ended up coping is that I ended up dropping that job in December after having worked there for 10 years. And that was very sad for me. But I just realized there's too many information sources coming into me, and I needed to somehow limit the number of processes that I needed to learn and adapt to.
And it sounds like, Dr. Birch, too, a couple of things that you mentioned, and I want to take a moment just to clarify, summarize, and make sure we heard it all. But it was the stress was multiple, right? You've got multiple systems, multiple positions. You're figuring out how to support these patients that are coming into an inpatient facility, and and I think one of the things I heard from that, and correct me if I'm wrong, was not being able to really provide the level of care that you would like to, because now all of a sudden you're having to sacrifice the number of patients that you could take in so that you could adhere to social distancing.
Right.
And but it also sounds like you got through it because inadvertently you created a community for yourself, because you're all trying to figure it out yourself together. Yes. and really finding those answers.
Yeah. And Dr. Carroll was a big part of that,
Mhm.
helping organize up in Northern Arizona. At first it was a loose collaboration, but it became stronger and stronger and more organized. And he did a fantastic job of pulling together a wide variety of organizations for us to work together effectively.
Yeah. And speaking of technology, Dr. Carroll, why don't we turn to you, and we'd love to hear the story of why you're in your car, because I think that's a technology issue.
Yeah, this is not how I plan to participate in this session, so my apologies. There you go. You can actually see me a little bit better. So, yeah, I'd like to think that I'm a person who can adapt and have resilience, but boy, there are just days that are challenging. And I'll tell you what gets me through are a couple of things. The first is knowing that there's community and there are folks who, given everything that the past year has been, that we can accept, understand, and help move forward. I'm remembering where my camera is, even on my phone, turned on the side. Sorry about that. So just knowing that I know Teresa and Menendra, and we have this connection, and I think that's what this program, in fact, is about. That there's that sense of trust that I know that it's okay and it's safe for me to show you that I'm sitting in the parking lot of a grocery store because the internet went down at home and suddenly I lost cell coverage at home as well. So here I am. And I think that's just been so important to develop that sense of trust. But I'll tell you that just for me personally, I have to work on that. That's a daily responsibility for me, but also a daily release. The notion that that people I know I can trust, but that there are new people that I'm meeting. In the past year, I've met a lot of new folks and worked with a lot of new people professionally, and developed and learned to trust people because we all have a common challenge and we all have some common criteria that we're working through. And I've just been amazed by the openness of folks sharing their own stories, permitting any of us to share stories. Certain sense of guilt, along the way that I'm not a full-time clinician, and so I'm not in the ICU, I'm not in the front lines, but that still plays a role, and that and I can still be helpful and have folks still accept that, as well as still support those through the phone and in other ways, virtual cups of coffee, as I like to call them, that we can learn to support each other and understand that while the experiences sometimes are very different day to day, our goals, our sense of compassion, what we're trying to do together is the same. And technology, this is probably the 25th type of way that I've figured out how to make technology work. And I imagine that's exactly the same for someone working in a clinical situation, either outpatient or in the ICU. I hear from them. So there are times, I'll just close briefly, Manager, where when you hit the wall, and Teresa, you talked about that. And yesterday was not as bad a technology day, but I sort of just felt like I sort of hit the wall, but learned and understood that first off, I could just take time, and the globe would still spin, and I could do the best I could, but folks would accept that. But then I could also reach out to others like Teresa, and to perhaps some of the folks that are connecting today, and share that, and then work through that. So I'm in the car because I have to be in the car. It's sort of one of those COVID requirements that if I was going to be part of this, I have to have the dome light on the car underneath a light in the parking lot. And by comparison, boy, that's a pretty small sacrifice to what many folks around the state right now are going through, being sick, their family members, and those who are taking care of them. So those small contributions help me keep things a bit level.
And thank you so much for that, Mark. And you also reminded me it's so important for us to let you know that the peer coaches are coming from all backgrounds. There's all different specialties that they practice and different positions that they hold. And so, for anyone who's looking for support from a peer coach, you can be matched with someone that fits what you're looking for. And sometimes it's nice to talk to somebody that's from a different background, and just to have I love that idea of a virtual coffee, because it's nice to kind of replicate what we might have had in person, where just being able to walk into a lounge and and share a cup of coffee with someone. So let's do that virtually. Um, and I want to hear from our coaches a little bit more, but Dr. Sandys, Jay, I'd like to hear from you a little bit about some of the themes that we've been hearing that have been coming through through the peer coaches, the people reaching out for support.
Sure thing. Let me just tell people briefly, for those who don't know, CCA, Corporate Counseling Associates, is a workplace consulting firm. We contracted with ARMA, and Juliana Stanley, who's here, approached us and wanted us to set this up. So it's the peer coaches are, and here's two examples, Dr. Birch and Dr. Carroll. We have a lot of others, and as Manendra said, from different backgrounds. And some are retired, some are newer physicians, all across the gamut there. And we really wanted to make sure that they were representing all the physicians out there in Arizona. And what we're trying to do now, as you're seeing, is we really want people to know about the program. We're going to be doing more of this, and we're trying to promote it in as many ways as we can. So we have been seeing some of the themes are really stuff you said in your presentation, Manendra. So, burnout. There's a big one, so a lot of people are coming to us with that, or just feeling stressed out, dealing with COVID and dealing with the current situation. A lot of isolation. So that's one of the things we see a lot of also, and people just want to connect. So, some of the requests that come in are, they just want to chat with somebody, to, another physician who can sort of understand some of the stuff they're dealing with. We've also had people that are kind of seeking advice. They're like, okay, I'm new, I have a practice, how are you coping, in this environment? Or, what are some ideas, or what are some resources, that kind of thing. So we've kind of been getting a lot of stuff that we would expect. A few mental health concerns, stuff like that. But really more of the other stuff, and caregiving. I guess that's another one. That was what I was trying to think of. That's one that people do come up with, if they have children, or if they have elderly parents, or stuff like that, and how do they manage that with some of the concerns about infection, and bringing it home, and et cetera. So those are the main themes we've seen.
Juliana.
Thanks, Manendra. I just want to say thanks to CCA for helping us to stand up this program. The Arizona Medical Association knows that physicians are having a hard time to begin with some of these, burnout issues and things. You dump a global pandemic on the top of it, and it's got to be hard. Some of the things that we hear is questions like, well, who's eligible? Well, Arizona MDs, DOs, and that includes residents. Right now, we don't have capability or availability, rather, to include students, but we certainly hope to expand to that later on. But I wanted to point out something, that this is a completely casual program. It's not something where we're going to be, keeping records or any of that. ARMA doesn't even know who contacts the program for assistance, and the peer coaches are trained by CCA to handle, to provide that peer support, and we never know who's participating. Another thing that we like to say is, in the before times, when doctors' lounges were open and you could actually walk into a doctor's lounge and have a cup of coffee with a peer, a lot of these issues that are being addressed would be addressed in that situation. You walk in, you're having a crummy day, and it's like, vent. Okay, you know what I was going through because you were there, and I feel better now. And it's that on the fly kind of conversation, that face-to-face conversation that we're hearing is not happening. And so that's why this program and this type of program is so invaluable, I think, to our Arizona physicians. And we're grateful to be able to provide that. Thank you.
No, thank you both. I did neglect to do my introduction at the beginning. I just sort of dived right in. So thank you for doing that for me. But I would like to hear from Dr. Birch and Dr. Carroll about some of the things that you've heard from some of the folks that you've supported, obviously being very mindful of their confidentiality and not sharing anything specific, but anything that you would add to what Jay and Juliana shared.
Yeah, sure. So let me give my husband a little clue that I'm off of mute. Hey, David. Yeah. Could you keep your sound down a little bit, please? Sure. Okay, thank you. He just got back from a
Welcome to Zoom.
Yeah, got back from a mountain bike camping trip down there in Phoenix, where he was like for the last 5 days, and he was rained out, and now he's trying to clean all his equipment in the sink right behind me. First of all, I just want to say that I have so enjoyed being a peer coach as part of the ARMA program. It's been very rewarding for me. The people that I've coached so far, we have had a good time, just laughing and commiserating and problem solving. And the types of things that people have discussed are changes in their work situation, where they kind of got trapped when they were transitioning to a new job, and then the pandemic happened, and some areas that they had hoped to solidify prior, that they had hoped to solidify as time went on, all fell apart because they were remote, things were frozen. Some of the resources that they thought they would have, they didn't have in their new position. And how to adapt to those changes was difficult, because they didn't know how long would this pandemic go on for. And so what we did was we focused on, okay, well, what could you do about your situation right now? Like all we know really is today. And so are there things, do you need to change your circumstances, or do you just need to change your thinking about your circumstances? And, you know, for both of them, it came down to more just, I'm just going to change my thinking about my circumstances, because I don't know how long this is going to go on for, and I'm in it, and I can't get out of the river. And so how do we make the best of it? And I think helping, working together to think through those things helped me also look at my own situation too. I actually did step out of the river though for mine, because I dropped one of my jobs. It's a mutual collaboration and respect, and I got just as much out of it as I hope that they got from my participation in it.
Thank you so much. Dr. Carroll?
Yeah, Teresa, you said what I was going to say. It was a mutual give and take, and in my experience, and I've just found that people sometimes just want to have that conversation and see that frailty. Also get advice too, sometimes from folks you don't know, and just a third-party perspective or just some thoughts. I see myself less coach, more just peer. I've had the opportunity, like others, to work in different environments in my career, and both full-time clinical as well as administrative, and been a hospital chief medical officer. So I know what it's like to walk into a doctor's lounge and with one intent, and hope to escape, you know, with your limbs intact sometimes, based on how people are feeling on any given day. You know, I think if this is any indication to folks just how it is for those of us who are volunteering to be part of peer coaching, just by my circumstance sitting in a car. I mean, the irony is once or twice, this is how I've actually had conversations with folks that that I've been connected to, because it was the right time for both of us. And it seems like sometimes it's in those in between spaces where we try to find the ability to chat and make connections. But I encourage everyone to realize that we are all peer coaches, we're all peer mentors, and sometimes we're talking, sometimes we're listening. I know that probably everyone does this for others, formally or not. Those texts that you send friends and just say, hey, how you doing? Or how's it going in your facility? Those emails and then those formal connections all make differences. I know they make a difference for me, and that's what I've heard. So, Manandra, you gave us great training, and so I'm very appreciative of that. You probably would have trained us in UNJ not to be in your car when you're doing these things, but I just try to
You
bring.
make do with what you have to sometimes.
I just try to bring authenticity and good listening and respect, and I think that's what we're all trying to hold on to and nurture in each other moving forward. And that's going to be so important for physicians, but the entire healthcare team. And so many clinicians, physicians in particular, are role models and team leaders. It's nice for them to be able to take a moment outside of that, but also to acknowledge that others are aware of that, others respect that and appreciate that, and no small amount, no small act of support, and no small amount of kindness is too small. It all matters. Thanks.
That's wonderful. Thank you so much both for sharing. And I think what we're hearing through all of this is how important these programs are, just to provide that space. And Dr. Birch, Dr. Carroll, you both said the same thing around just sometimes it's about listening, sometimes it's about laughing, sometimes it's just being there for somebody in a way that somebody else may not be able to understand, but as a peer being able to understand. Dr. Sandys, I'd like to ask you to maybe, so go ahead.
So the other two things that the coaches that, or the people that I was participating this with, they all said the same thing. They all immediately apologized and said, I don't think my problems are that big. Maybe I'm using up your time. Maybe somebody else has more difficulty. And they were very apologetic about reaching out. And I'd just like to say to anybody who's considering doing this is that you don't have to be super distressed to do this. It's not like I'm volunteering my time. I'm not feeling burdened by this. And people had a lot of shame too. And, please don't feel shame. We're all struggling through this right now. And go ahead and reach out, because the time is not, it's not like therapy or something where you have this frame that you have to stay in and like it's only this many minutes. It's like it can be 10 minutes, it can be 45 minutes, and so whatever is helpful to people, that's really, I think, all we're trying to offer here.
Thank you so much for sharing that, because I think you just brought to life one of the things that I was trying to highlight in my presentation, where it's not abnormal for people to internalize or dismiss away how they're feeling. And if you're feeling like you need to talk to someone, then you need to talk to someone. And I think the example that you just shared is super important for that. Dr. Carroll, did you want to add something? Otherwise, I was going to ask Dr. Sandys to kind of help us understand, and Dr. Birch, you just did this, is the distinction between a more traditional program and a peer support program.
Sure thing. So this was purposely, first of all, I love what Dr. Carroll and Dr. Birch just said. And it was always our intention that the peer coaches would benefit themselves. And so I'm so happy to see that, right? This is part of changing the culture in the medical field, right? That's part of what we're trying to do here. and that helping everybody and mutual support. So what's so different about this is it's non-professional, though you are dealing with another physician who's been there, who's experienced things that you have as a physician. It's not a professional relationship. We're really trying to replicate the doctor's lounge, the it's informal. People might keep they might jot down a few notes to remember, what happened, but there's no formal documentation. There's no reporting. Menendra and I, the reason that we were engaged in this project is because we're both mental health professionals. We are both very used to confidentiality. We understand how it works. ARMA does not know. Nobody knows. The only, really I know, who's calling, and then the peer coach will know the person's name. We don't even, we just ask for first name, last initial. I think normally they are probably sharing more than that, but it's not official. It doesn't go anywhere. There's no reporting of it. So it's a lot different than that. And let me just, there was a question that came in. I'm jumping ahead to this, but for part of the QA, it's pertinent to this. They're saying, what happens beyond the 3 to 5 sessions? And I just want to say, we built this to have some structure to it, because we weren't sure if we were going to be overwhelmed with too many people. We really need to control a little bit how long people were engaged with each peer coach, so we could get new people in if there was a high enough volume. But it's really not set in stone. So what we've seen a lot of is people will have one session. I was kind of envisioning they'd have one session and they'd schedule the next one just like a therapy session, a week later. And it's not at all like that. They call, they have their session, or meeting, or it's not even a session, so a meeting, whatever you want to call it. And then sometimes they just say, I'll call you again if I need to. A lot of people have done that, and they've met, 2-3 times is probably the average. Some people might meet more, but there isn't a strict limit. So if somebody got to 6 or 7 and it made sense, we would just be discussing it, internally and say, does this make sense? Or do we really think this person needs something else? And then we'll help make a referral. So though this is non-professional, we at CCA have a lot of resources and expertise. So if somebody did need something, professional, then we can help refer to that. If they want, it's entirely up to them, but we'll just give them resources. But it's a lot different than a therapeutic relationship. And really people are sharing a lot more about themselves than I would in a therapy session, right? I'm not talking about myself much, but in these relationships, it's back and forth a lot more. So it's much more of a peer-to-peer connection, and it's community. That's what we're trying to do here.
And I think to that point, and Dr. Kell, I think you mentioned this, and Dr. Birch, you also did, and you both of the things that you shared, is that it's the opportunity to build relationships. It's the opportunity to talk to someone in a way that is just talking to a friend in some ways. And it's so important for that to happen. Has just to kind of come back to both of you for a quick second here, have people, when they've reached out to you, been concerned about confidentiality, and how have you alleviated some of those concerns that has helped people speak up?
And maybe we could talk a little bit about, the fact that you don't have to report anything because of the nature of the program.
Yeah, Teresa, why don't you go ahead first?
You're off mute.
I think she just passed the baton to you again.
She passed it to me. Okay. So it is confidential. I know folks hear that and they're told that, but it's how we act that. And I think we reinforce that to folks, and have a conversation that is not a therapy session on purpose. My background is, my board certification is in pediatrics, and I'm mostly an administrative physician right now. So as you said, we can talk by chatting a little bit about where we come from in our walk of life right now, so that it does feel more peer oriented, and it it demonstrates that. We take no notes. The follow-up is only additional conversations like friends would make after they've met, deciding if they want to reconnect. It's offered. Some people will say, "Sure, I'd like to chat." For me, some of the conversations have just been very cordial and collegial, and folks have said, "Yeah, I'll reach out." But this has been really helpful. Sometimes people are looking for information too about, hey, how do I engage? I think Jay, you referenced this, that sense of connection. What can I do to get engaged? Wow, I heard that you're involved in such and such. Is it, how might I be able to participate? Because I think that's, as clinicians, how we like to work through things, but we also like to participate and give and be part of things. So, it's absolutely confidential. There are no notes. Nothing gets reported back to anyone, and it's all at the discretion of the individual if they want to continue having these dialogues or not.
Yeah, and so it also can just be by telephone too. Mine typically started by telephone and then switched over to Zoom once people became comfortable, because then they felt like, oh, it really would be fun to see what you look like, versus my little Minnie Mouse voice. It's up to it's up to the participants how much you want to share or not share and how anonymous you want to be. We have to know at least how to contact you. But I know, like, one of mine, I couldn't tell who that person was based on their email. So it's really just only what somebody wants to share.
And Teresa, might I just add that this is not to minimize the effect that COVID's had on some folks. PTSD is real, and many healthcare workers, unfortunately, may experience it following various experiences that people have been having. We know this from past outbreaks and responses to them around the world. We know this from traumatic events. We also know this because as a culture, we don't talk about things, and probably all of us have those memory triggers that are not overt PTSD, but are trauma-like. And I think so it's important for us to have that trauma-aware and informed culture, but my role and Teresa's role, we're not here to be the therapist or to identify that. And we share that with folks. However, if folks maybe would benefit from seeing someone more formally, that is part of our role to if that's a trusted space in a dialogue with someone, to suggest that might be possible for them to consider. But I think it's part of our collective role to recognize that. And I'd really encourage us, and really big shout out, Juliana, to you and to Arma for this, that all sorts of connections are going to be important moving forward. Jay, as you said, we want to change culture, but there will be a % of people who, surprisingly to themselves and unexpectedly, are experiencing symptoms of PTSD. They need to feel supported, and they need to understand that the culture is one of embracing and helping folks who have been through some really traumatic experiences in the past year, and getting help, and not having that be punitive. That's going to be our collective work moving forward, as well as supporting each other and our mental well-being along the gradation of our needs. But some folks will benefit from therapy, from seeing Dr. Birch and others in a more formal situation. And the more we can have conversations, and I think use the terms mental health, mental well-being, and all of us just accept that that's part of our whole person and our whole selves, then the better we'll all be, and the more folks will get more timely access to care when they need it.
I think everything that you're sharing is so important. And, when we talk about, and Jay mentioned this, that we are clinicians in terms of mental health clinicians by training. And one of the things that I always like to think of is mental health is dynamic. It's changing, it's evolving. And we've never been in a position like this. We can study it based off of what other people have experienced in past history. But when you bring up, and Dr. Carroll, as you just mentioned, that people were coping with so much before the pandemic happened, and those things didn't go away. And we add this layer of now watching and seeing things happen in a way that was so quick and so drastic, and it's so hard to see. It is going to take a toll on us. And I think what we want to encourage is for people to reach out and get support. And if it's with us, as in the Virtual Doctors Lounge, fantastic. If not with us, then reach out and get some support from somebody that you feel comfortable talking to, because that is actually going to be one of the advantages that people will have to cope with the aftermath. One of the things we know about what we know as in terms of what people have shared with us about doctors is that you are fantastic in the crisis, because that all your energy goes into that. And it's so important to focus in on that. And we are bringing this up to you now because we know that once, hopefully there is a light at the end of the tunnel, when things start to slow down, you might start to feel the effects in ways that you were not expecting. And so if you start taking care of yourself now, hopefully that will set you up for success down the road. And so to that note, I want to ask all of our panelists to share with us something that they have learned through this pandemic in terms of how to take care of yourself. What's a strategy that you've developed or utilized as a self-care opportunity? Because we're all in it with you too. So I'm not sure who wants to start, but what would be one thing? Oh, Dr. Sandy's, your hand went right up.
It's for me, it's making a concerted effort to have social connection, whatever that looks like. Making a phone call, calling old friends, setting up a Zoom call with people. I'm pretty careful about COVID. I'm working 100% remote. And if I don't make sure, exercise actually also maybe equally, getting out of the house sometimes. But so the biggest one for me is that social connection. And in a way, it's what we're trying to do here. We're trying to build social connection and have people reach out to each other. And for me, it's talking to colleagues. You don't have that downtime at work like we really used to have in the office. And and I realize I'm actually probably much more efficient now during COVID than I ever was in the office, because it's almost pure work. I'm just doing work. I'm at the computer doing work. And I realized just how much time was taken before, just hanging out and talking to people. And I think eventually I start missing that. And so that's something that I make a concerted effort to do, even sometimes when I don't totally feel like it, but to really say this is a priority and this is something I need to do.
Next. Who are you who are you gonna pass the baton to?
I pass it to Mark.
Thanks,
All right,
Jay.
Mark, you're up.
Teresa, you know where it's coming next, the baton. I think I just try to bring my authentic self and then forgive that self when it's imperfect, which it is pretty much every hour of the day. And also just recognize try to recognize that what feeds my soul. And I'll just give you one example. Yeah, Jay, I mean, the past year, boy, sometimes on 2 or 3 different calls or meetings, all supposed to be important at the same time. Just not something that we typically would have done before. But in the past month, I found myself, I offered, and then the help was accepted to participate in some of the state's vaccination efforts. And so I've donated a bunch of time on weekends for that and interact with more human beings face to face than I did the entire year last year, and probably the 2 years before that, helping in some of the vaccination pods. And but it was a really important experience just for me, and one that helped me kind of just reconnect to why I got involved in medicine, even though in med school they didn't teach us much about IM. deltoid injections. I've gotten pretty good at those, but how much I really enjoyed interacting with people and people who were seeking care or seeking help. So I think that's what's helped me, and then being able to participate in activities like this. So thank you. I'll pass it now, Teresa, to you.
I think the things that I've done is really work to stay present, to stay in the moment. I think it's really easy with working. I actually still go into work. I have a work site, and then we do remote out, but all of us come to the site and work there. So I do have social interactions, but we're doing rounds on video, and it's really easy to be checking your phone, looking at all this stuff that's coming in, reading the news, looking at your PowerPoint. Meanwhile, the person who's trying to chair the meeting, it's like they're doing a podcast. And I feel like that a lot when I'm the chair of a meeting, like I'm doing a podcast. And people take their videos off, and so you can't see faces. That makes it really hard. And so I'm just working on myself to stay in the present, focused, not try to do too much multitasking. It does leak in there. I'm not perfect at it for sure. But so that's helpful. The other thing is realizing that when people are not their best selves, that we're all under stress, and to not take it personally, and to give people grace, and also to explain to the other team members, if they come and they complain about so-and-so's being this way or that way, is just to help them see that it's not personal. Everybody's struggling, and some days you have a good day and some days you have a not so good day. And we're all going to be at that low point at different times, and hopefully as an organization we're not all at the low point at the same time. And then on the weekends, I don't do anything with a computer or internet or Zoom on Saturdays. I go outside, I do chores around the house, whatever, shovel snow this last weekend. But just, I feel like my focal length has shortened, like I can only see this far away, and I need to be able to see a lot further and be out in nature, because, lots of studies show that being out in nature is really helpful. So that's some of the things that I do.
And that takes us to Juliana.
All right. Well, thank you all so much for participating with our town hall tonight. It's been super informative and interesting. And I always find it fascinating to listen to these conversations, because I always learn something. And just to hear the relief in your voices for how you've managed to get through this it's rewarding in and of itself. So thank you for helping us to bring some of that relief to all Arizona physicians. The contact information for the program is here. It's simple, www.virtualdoctorslounge.org. All peers are physicians. It's informal. It's free. All Arizona licensed physicians are welcomed, and we hope that you'll contact the program for a virtual cup of coffee with a peer, and if not through us, and if you're struggling, then please talk with someone. But we're happy to help. All right, Damien, do we want to wrap up?
Yeah, I think that was a good wrap up within itself. If anybody has any questions or concerns, you can always reach out to us directly at communications@azmed.org. We appreciate and thank our panelists definitely for taking time out of their evening, not only for taking their time out of their out of their days to participate and help us with this program, but also take time out of their evening tonight to help us with this presentation and bring some light to the discussion on this new and great program. So we hope everyone has a great evening and appreciate you all stopping by, and be well. Thank you for
All right.
thank you for
Thank you
joining.
all.